Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop neck pain. But before we do that, we need to understand what is the neck pain symptoms and the causes, the risk factors that actually trigger neck pain, because that will help to really get to the root cause of the problem, and then I will go over the steps that you can take to stop neck pain. So neck pain, it's usually increased with maintaining bad posture for a very long time. If you're slouching in the front of the computer or in the front of your iPad or iPhone or your phone or tablets, that will cause a strain in the neck. That's a very common cause. And usually patient feel tightness in the neck, in the trap area, and when you palpate and touch this area here, you will feel nods, and that's typically a scar tissue build up from slouching for a very long time, and that slouching causes strain, and I will show you why in the next slides. So the symptoms you might experience: neck pain, tightness, severe cases when you have herniated disc that pushing on the nerve. You might have numbness and tingling in your arms, and you feel stiffness in the neck, and also you can experience some headaches. So when we look here in the neck, in the front view of the neck, one of the causes is actually herniated disc. So if the disc is pushing on the nerve in here, you will start to have radiculopathy or numbness, tingling that going down to your arms. That's not very common. The most common is the tightness, a stiffness in the neck muscle, a lot of scar tissue, a lot of fascia restrictions. So the causes, the biggest and like the most common cause for neck pain is poor posture. And you can see here in this image, if you are in neutral good neck posture, you can see the first guy here, the neck weigh about 10 to 12 pounds. When you start to flex a little bit more, 27 pounds. Let's look when you slouch all the way and looking at your phone, that is 60 pounds on your muscles. So you do that for 5-10 minutes or half an hour or several hours, you're straining your neck muscle, your traps, your neck stabilizer muscles. And when that happens, you start to have micro tear, and your body gonna naturally build the scar tissue to heal those areas, and you start to feel nods. So posture is extremely important to correct, because it's a common cause for neck pain. So the other cause is prolonged sitting, driving, or in the front of the computer. When you sit for a long period of time, watching TV or driving, you start to slouch, and that's a really high risk factor for having neck pain. The other issue could be from whiplash injury, like motor vehicle accident or any sports injury that cause head trauma and strain your neck muscles. Herniated disc, as you see in this image, and here the disc is pushing on the nerve that going down to your arms, and that usually caused by whiplash or poor posture, poor body mechanic for a very long time. Because when you are bending forward like this, your weight is not even on the vertebra. So let's look here. So your vertebrae should be on the top of each other in neutral position like this, sitting really distributing the weight evenly. So when you slouch forward, your weight mostly forward. So when this happens and you do it for a very long time, as we said, your head weight will be a lot more, and also you're gonna start to wear out your disc in the front, because your weight more on the front, not evenly distributed, and that could cause herniated disc and wear in your joint. So the other reason is osteoarthritis. We're all gonna get arthritis, but some people get it more when you start to have like whiplash, injury, or poor posture for a very long time. And you can see it in this image here. Here it's look like everything nice and clean. The desk here clean, and vertebrae, there is no uneven surfaces. But when you start to have osteoarthritis, like in this image, you start to have bone spur scarring around this area. That causes a lot of stiffness. The other reason is cervical stenosis, which mean, so in the spinal canal, normally you should have like a good space so the nerve will go, I will show you here, will go in the spinal canal freely. Spinal stenosis, which mean narrowing of the spinal canal. So that's a not very common condition, but it could happen for some people. So what I want you to focus on, if you don't have these issues, focus on the posture, prolonged poor posture or bad posture, or if you have whiplash. Those mostly the common causes for neck issue or neck pain. Facet joint syndrome, the facet of the vertebra should be on the top of each other like this. Facet joint syndrome, usually one side is slipping or it's kind of like off, and that's cause pain in neck area. That's easy to treat when you release the fascia, release the scar tissue. The vertebra will do some core stabilization exercises. You will get your vertebra in correct alignment. So muscle strain due to hunching posture. The other risk factor is if you have rheumatoid arthritis, cancer, or meningitis. Those are risk factors that could lead to neck pain. So how to treat neck pain? We really, to get to the root cause of the problem, we need to look at the normal healing cycle and to figure out where you're stuck in that healing cycle and address it based on the healing cycle. So I'm gonna go over external paper cut for visualization, but the same process happened internally from accident, trauma, poor posture, poor body mechanic. Your body has to go through those 3 stages in order to heal. So the first stage is inflammation. As you see in the first image here, swelling, redness, the blood start to rush to that area. Second stage is the proliferation stage. That's when the body starts to build the scar tissue, as you see here. During that stage, there is a cascade of events: fascial restriction, trigger point, scar tissue, and muscle spasm. Finally, the maturation stage, that's when your body starts to clear up everything, the scar tissue, the fascial restriction, and the inflammation, and the healing cycle complete. That could take days, weeks, or years. As we get older, the process of the healing decreases significantly. So the problem, if you do a lot, like prolonged poor posture, you're causing the strain, you're causing the inflammation, your body building the scar tissue. But you're not giving your body a break to heal, and you continue doing the bad habit, so you will go back and forth between inflammation and proliferation stage. That's one of the main things we have to work on, is correcting your posture. And make sure you subscribe to the channel. I will have videos specifically on how to really correct your posture very easily at home. So the other thing I want to show you here in this image, when your normal muscle should look like this, nice and clean, but when you start to slouch forward or you have any injury in the muscle, you start to have those tears here, micro tear. And your body, when your body builds the scar tissue, it's actually built the scar tissue randomly. But think about this way: you strain it from poor posture today, and tomorrow you did the exact same thing. That's another injury back to back. So your body gonna build so much scar tissue in that area, and will be in constant inflammation and proliferation like here, and you're not giving enough time to really clear it up. So when you start to palpate on your muscle and your trap, you will notice there is knot, hardening, or band, and that usually fascial restriction, scar tissue in that area. So what you should do to treat your neck pain. Okay, I'm gonna go over first the stuff that actually not effective, so you don't have to waste your time on. First thing, what I learned in the school, and that's a lot of therapists, they use a lot of this treatment, but based on the study, provide either temporary pain relief. There is no long-term result from these modalities. First, to really know if the treatment work or not, we have to look what that treatment gonna do to the healing cycle to break it, the vicious injured chronic condition cycle here. So IS is temporary decrease inflammation. It's not gonna do anything to scar tissue, fascial restriction, or muscle spasm trigger point. The second thing in the list is electrical stimulation. It's temporary pain relief. It will not do much to the inflammation or proliferation stage. Foam roller and massage. If you are in inflammation stage, and you rub inflamed area, it's gonna inflame it more and it's gonna cause more scar tissue. And in the next few slides, I will show you why anatomically impossible for foam roller and massage to do deep release for scar tissue and fascial restrictions. And based on the study, it provides temporary pain relief. So there is no long-term from foam roller or massage. Stretching. That's the first thing when you look for neck pain on YouTube, a lot of stretch exercises. The problem is stretching actually stimulates inflammation in the body. If you overstretch and you have a tear in your muscle and you stretch it, you're gonna tear it more. You're gonna make it worse. You're gonna cause more inflammation. You're gonna cause more scar tissue. And I have video why you should not stretch. Check it out on my YouTube channel. And there's safe alternative approach than stretches. I personally do not give it to my patient, so I don't recommend it to anyone to do stretching. There's other safe approaches that can be done without causing harm. Strengthening exercises, there's much more important than strengthening exercises. We need to do core stabilization, but strengthening exercise is not going to be effective if you don't correct your posture. So, and if you are in inflammation stage, if you do the strength exercise, you might make it more inflamed. So what I personally do is I work on each stage and break it down and then do the posture correction, core stabilization, because the body is ready. There's no tightness that pull you down in the poor posture. Okay. So what I do for inflammation stage? Well, first of all, you need to stop one of the main trigger, which is actually poor posture. So if you slouch forward, you need to really sit up, suck your stomach in, really sit up nice and tall. Rest for 5-7 days. If you are in acute stage, that should be enough without avoiding the poor posture, prolonged sitting, prolonged driving with poor posture. That should be good enough to really get mild inflammation under control. If you still have pain more than 7 days and moderate to severe inflammation and your body going back between the inflammation and proliferation stage, you need to be aggressive to break this vicious cycle from both ends. So what I personally do, I use a Magna Heal 2 for decreasing the inflammation, and it comes with the strap. You can wrap it around your neck. There's another strap with it as extension. The magnetic force is about 3 inches. So it can penetrate the body up to 3 inches. So that's what I use. The other thing I use it at the same time is anti-inflammatory diet. There's a lot of food cause internal inflammation. I want to make sure my patient eating a healthy diet that actually does not slow down the healing cycle. For chronic condition that patient body does not heal, we have to look for any deficiency they have. So one of the way you can take advantage of Ask ASTR, it's askastr.com. It's free online medical evaluation that has 9 healthcare provider database. The evaluation takes about 5 minutes to figure out if you have vitamins, mineral deficiency, or hormonal imbalance that slow down your healing. Because reality is your body needs magnesium, D, for example, C, B. to transition from inflammation to proliferation to maturation. And if you have any deficiency, your body's not going to transition. The Magna Heal going to help with decreasing the inflammation, but it's not going to replace your magnesium deficiency, for example, or B. Especially if you have chronic condition, typically you have some deficiency. So I like to address that at the same time, especially for chronic inflammation. The other thing we have to work on is a proliferation stage. So what I do for the scar tissue and trigger point, I use the A3 tool to really go deep to really break the scar tissue in the neck area. So that's what I use. And also I use the A5 to break trigger points and actually release deep scar tissue and the fascia restriction. And that the A5 really can go very deep, to 2 to 3 inches deep, to really get those knots breaking down. So the other system we have to work on at the same time, briefly I'm gonna explain the fascia system, but it's a very complex system. Don't worry, the treatment is very simple. And I'm gonna go over the system because I want you to appreciate the complexity of the system and understand if you don't release fascia restrictions, your neck pain probably will not improve much. By understanding the system, it makes a lot of sense. We have to work on it simultaneously with decreasing the inflammation. So the fascia layer, the superficial fascia layer, it's wrapping the entire body. It's like a Spider-Man suit, wrapping the whole body. You can see it here in this image, the white web tissue here. These are the fascia layer. To make things complicated, but the treatment very simple, the fascia system divided to 2 main categories, the superficial layer and the deep layer. And the deep layer is actually divided to 4 subcategories. To make things more complicated, each of these categories, like the apparatic fascia, has 2 to 3 layers. So the apparatic fascia is like a wrapping actually a group of muscles. Then we have the epimysin here that's wrapping each individual muscle. And then we have the premiysin that's wrapping a bundle of fibers. And we have the endomysin wrapping each individual fiber. So I'm showing you this to see how significant the fascia system that affecting the body, because you cannot pick and choose which layer of the fascia to release it. That's why massage does not work, stretching does not work, foam roller does not work to really break those adhesion, because they are very deep. You need to have mechanical force. Think about this way: you have fascia restriction or scar tissue and you're doing a stretching, you're gonna inflame it more. You're not gonna break the scar tissue. You have to really dig in to break the scar tissue or release the fascia restriction. So what I personally use, and I give it to my patient, is I use the A1 to release superficial fascia restrictions and the apparatic fascia, and I use the A5 to go deep to release the epimysin, premiysin, and endomysin. And the neck patient, they usually use this tool a lot because they have a lot of knots on those areas, and a lot of the time a lot of tightness in the head, that they can use those tools very easily on themselves, especially if they start to have headache or something like that. It's easy to use it on your head. So to wrap it up, what you should do for neck pain, whereas first you have to correct your posture. There's no other option, because even if you get treatment and you start to slouch forward again and have those poor posture, you're gonna re-injure yourself again. So proper posture, I have videos on that, and I will have more videos on proper posture in the future. We have to do core stabilization. Some people say, oh, do strengthening and stretching exercises. That's not gonna stabilize your core. We need to really specifically stabilize your core, and we'll have more videos on that. Then we need to stay active. You really need to move your neck back and forth, forward and up, freely, pain-free. Especially when you sit on the front of computer for a long time, you need, instead of stretching, just move it around, make it flexible. Don't stretch, just move your neck around. But make sure the exercises you do is pain-free, and I will go over more exercises you can do at home in other videos. For chronic condition, you have to break this vicious cycle from both ends. So for inflammation, I use the Magna Heal, the anti-inflammatory diet, and with the proliferation, I use a tool to break it and release those tightness, and immediately I have patient correct their posture, do the core stabilization. If you have any question, leave it in the comment section below, and I will answer it in the future video. So I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.